Obviously everybody does cataract consent a little bit differently, but there's a few basic points that you need to get across, and I suppose everyone will put a slightly bit different emphasis on those points, but there are some fundamentals that have to be expressed and understood by the patient so that you can give adequate consent. And I've actually recorded this consent with the patient's permission, and this is actually a live consent, so it's supposed to be as comprehensive as I could make it, but as you know, every patient's slightly different, so you have to tailor your consent according to the patient. Like some patients say are fairly easygoing, and that they want to know the bare essentials, and you've got to give them the bare essentials, and they don't want to know too much about complication. You do have to mention it, but you don't have to go into too much detail, because I find sometimes if you go into too much detail, it does overly concern them, and you may be unnecessarily alarming them. And then you get the other types of patients who want to know everything about the operation. They want to watch the video on the operation. They want you to go step by step through the operation. Some patients have even asked me to talk to them during their operation while I'm doing each step. And they're also the type of patient who want to know every single complication, the potential percentages that the complications occur, and what happens if there's a complication, and how would I manage it, and how often do I get the complication. So there's a whole gamut of patients, and the thing is you have to tailor your consent process according to the patient.
I think you're right, Graham, and increasingly according to the relatives as well, because the patient themselves can sometimes be very laid back, but the relative, for reasons that you may not always be privy to, is overly concerned, overly anxious, guilty, whatever. And so you can potentially sometimes have an aggressive relative and a nice patient. And so you've got to be a little bit careful that you fully assess the dynamics of the people directly involved. And, one of my rules about only eye surgery is that as part of the consent process, I say, well, there's a small risk.
If you enjoyed this lecture so far, please subscribe to http://iop.vision. I hope you enjoyed this series as much as we have putting it together. Thank you.